Obesity is quickly becoming an epidemic in our country. To help combat this problem in Polk County, we have Dr. Joy Jackson from the Polk County Health Department and Jamie Moore from the Lake Wells Medical Center here today to speak about what's being done to help educate the public about this quickly growing problem. Ladies, thank you for coming today.
Thank you. Thank you.
Talk to me a little bit about the issue of obesity and why we're having this discussion today.
Obesity is recognized as a growing problem, no pun intended, but currently in America about a third of adults are obese and about 17% of adolescents and children are obese. Polk County's rates are even a little bit worse than that. About 37% of Polk County adults are obese. If we look at overweight and obese, it's over 70%. In 2012, a survey done for Polk County high school students revealed that 18% of Polk County high school students are obese. So again, it is a growing problem and something that we all need to look at. The rate of increase in the nation over the past 20 years is incredible. The rate of obesity 20 years ago was far less than it is now. And again, in all demographic, socioeconomic, racial, everything, everyone is getting heavier. You know, what's causing this? And I think a lot of work has looked at what is causing the increase in obesity. For one, we are more sedentary than we were 100 years ago. 100 years ago, the average worker the average worker used about 2,700 calories per day to work. Now the average worker uses about 700 calories. So with advances in things that make our lives easier, we're much less active than we were. We also have access to a lot of foods that we can choose by spur of the moment that may not necessarily be the healthiest for us. So, you know, in the difficulty with a fast-paced life of planning meals is also a problem. So it's really a combination of factors that's contributing to this.
That's amazing. Mm-hmm. Now, out of curiosity, how does one realize whether or not they're obese? What can they do to figure out, okay, I am overweight?
Mm-hmm. An industry standard right now is a measurement called the body mass index. And a body mass index is a number that correlates with body fat. It does not directly measure body fat. To directly measure really requires more expensive and invasive procedures like MRIs and CAT scans. But a body mass index is a number that's driven by your height and your weight. Okay? And individuals can measure this themselves. If you go to the physician, which you should, your physician should also be measuring body mass index and having discussions with you. So there's a couple of ways that your viewers could even determine their own body mass index. And one way to do this is to use, and this looks very intimidating, a nomogram. But the easier way to do this is to go online, if you have access to the internet, and if you will use a search engine and just look for a BMI calculator. The CDC website has a very user-friendly calculator where you just put in your height and your weight, and it will tell you what your BMI is. Children is a little bit more in depth. For children under 19, it's their BMI, but then they're compared to other children of their same age, so it's actually a BMI percentile. For adults, a normal BMI, a healthy weight BMI, is between 18.5 and 25. Overweight BMI is 25 to 30, and obese is a BMI of greater than 30.
So everyone really wants to be in that 18 to 25 percentile.
Yes, exactly. One caveat with the BMI, though, it is again not a perfect measure, but athletes and people with a lot of muscle mass can have a falsely elevated BMI because muscle weighs more than fat. So it is not 100% guaranteed that an elevated BMI means that you're too heavy. Again, in those that are young and healthy and have a lot of muscle mass, it can be a little bit misleading.
Oh, that's perfectly understandable. Mm-hmm. Now, out of curiosity, I know that knowing your BMI is important, but why is it important, and what are the effects of it happens to the individual if their BMI is too high?
It's important for individuals. I mean, it's nice for your doctor to know your BMI, but the real key is for the individual, the patients, to know their BMI, because that then empowers individuals to be responsible for their own weight. The desirable, obviously, is to have a normal BMI and never get overweight. But if you see that each year you're adding some points, some weight, and you're seeing your own upward trend, it's time to make some changes in your lifestyle. And weight is it's really a simple equation, but it's not necessarily easy to control it. It's how many calories are you bringing in and how much exercise and energy are you consuming with what you do in your daily life. Conditions that are related or associated with an elevated BMI are things like diabetes. Type 2 diabetes is becoming an epidemic in this country because of obesity issues. Hypertension or high blood pressure, heart disease, strokes, arthritis, and also very importantly are pregnancy outcomes. Women who start a pregnancy already overweight have far more complications related to the delivery and puts their babies at greater risk.
I know that in speaking with a lot of my friends, they're going through that problem during pregnancy with the fact that the women are getting diabetes during the pregnancy because of the problems with their weight.
Right.
So yes, it's definitely very interesting.
And there's also some research coming out that those babies that they're pregnant with while they have gestational diabetes are at increased risk for having diabetes later in life too.
Oh, that's very interesting. Very scary to think about too. Definitely gives us more motivation to try and be as healthy as possible. Now, what can an individual do to improve their BMI? I mean, what do you suggest are the important factors that people think about when it comes to their weight and their health?
Well, I always say that there's lots of ways that we can go about attacking this problem or trying to stay ahead of it. The number one thing I tell people is portion sizes. At my classes, I preach portion size, portion size, portion size. In this country, we have no idea what a healthy portion size is. We eat what's on our plate. We came up with that whole thing of don't waste any food, so we have to eat everything. So we really need to start paying attention to what a portion is. A lot of people complain that my dietitian portions aren't what they're used to, but it's something to focus on and get an idea. So for an example, 3 ounces of meat is about the size of a deck of playing cards. So that would be one thing to look at. And that's the amount of meat that you would need for lunch and supper.
Tastier too than a deck of playing cards.
Yes, it is. Put a little garlic on it, it makes it even tastier. And then when you look at things like potatoes, rice, noodles, dried beans, again, we're about a half a cup. This is what a half cup looks like, and this is actually a portion.
Oh, okay.
Okay? Actually, if you're diabetic, a third of a cup of rice and pasta is a portion, so it's even smaller than people think.
Okay.
So it's a portion size thing. When we are looking at fruit, we're looking at a piece of fruit about the size of a tennis ball. Or if we're looking at juices, about a half a cup. Again, most people do not have a half cup glass in their house, so when they're having a glass of juice, they're probably having 2 to 4 servings of juice.
Oh, wow, that's amazing to think about.
So it adds up. Now here's a big thing that people do not really think about, that's what they drink. People drink many other calories in the day. Okay? What you drink does not fill you up. So we can drink 200, 300, 400 calories with our meal and not even be aware of it.
Oh, wow.
So for every regular soda, an 8-ounce soda is about 100 calories. So if you start to look at bigger cups, because again, this is what 8 ounces looks like.
Okay.
Anybody have that size glass at the house? Okay. So if you're looking at a 20-ounce soda, that's 200 calories. If you have a bigger glass or you've gone out and gotten a large beverage at a restaurant, maybe 32 ounces, now you're looking at something in the neighborhood of about 400 calories.
That's amazing.
So then if you have refills, it's even more. Then sweet tea is about 50 calories in 8 ounces. So again, we add that up. People drink throughout the day. So again, if they're drinking beverages throughout the day, they're adding calories they don't realize. I will throw out a cautionary thing here that the big thing right now is coffee. We love coffee. We love our coffee drinks, our specialty coffee drinks, and many of our specialty coffee drinks have 400 to 800 calories in them. So the drink has as many calories as the meal should have. So I challenge people to look at having no calorie or very low calorie beverages, whether it's water, diet soda, unsweet tea, or use some type of artificial sweetener, but be cognizant of those calories because we just don't pay attention to them.
Sure.
So they add up quickly. So look at that. Another area that people need to look at, we don't think about the calories that come from fat. Fat has more than twice as many calories as, say, carbohydrates or protein. Everybody thinks carbs are bad. That's where your calories are. So every tablespoon of oil, butter, mayonnaise is 135 calories and 15 grams of fat.
Say that one more time.
Every tablespoon of butter, oil, even if it's olive oil, or mayonnaise is 135 calories.
Wow, that's amazing.
Okay, and 15 grams of fat. So if we're just putting this on our bread, our toast, our potatoes, we are doubling and tripling the calories just by what we're adding to it. So if we take an average size potato, it's maybe 180 calories or 160 calories, and we add a tablespoon of butter, a tablespoon of sour cream, bacon bits, we've made a 180 calorie, now a 500 calorie potato. Example, again, a small potato is what they use to make a small serving of fries at a restaurant. It goes from 80 calories to 250 calories just because they deep fried it. So that fat is where a lot of calories are that people don't pay attention to. Your cream sauces, your Alfredo sauces, very high in calories. So we have to look at that.
Definitely.
So put it this way. If you have a piece of chicken, if you have a baked piece of chicken, it's 250 calories. You now take it and you deep fry it, it's 450 calories. You get no more food. So you have to look at some way of cutting back on that fried food. That's an easy way to cut calories.
That's a great suggestion. I never even thought about that in that perspective. But
yes, we love fried food. It tastes good, and we like it. And kind of playing into this high fat is we love to snack. Chips, cookies, just have to see what's being advertised on TV. That's what people want to eat. So again, these are very high fat. They're not advertising carrot sticks to eat when you're watching TV. They are advertising cookies and chips and all that good stuff. So again, very, very high calorie. And what 100 calories is maybe 10 chips. Nobody eats 10 chips.
Can only eat just one.
Nope. So very honest commercial. So again, we look at that. There's an interesting trend in our country that as people try to eat their food more low fat, our consumption of high fat desserts and premium desserts go up. The sales in the grocery store.
Interesting.
So we like to find our fat. Another positive thing that you can do as far as planning your meals, we have an example here. It's an easy way to plan your meal. Think of your plate. Think a quarter of your plate would be a serving of lean meat. A quarter of your plate would be some type of starch. Half of your plate would be what I like to call rabbit food, your veggies, a piece of fruit, and a glass of milk if you like it. And that's a very easy way to plan your meal that doesn't have to bring out all the measuring cups.
And the amazing thing about that is if you look at that, I'm sure that is a very filling meal.
It is. And again, food does not have to be bland. It just has to taste good and be portion controlled.
Definitely.
Okay. Some other things that we can talk about with snacks, again, it's easy to get derailed because you want a snack in the middle of the afternoon when you're hungry and the snack machine starts to look good, or you go find what's in the break room. It's usually, again, it's not carrot sticks. So you want to look for snacks that are healthy, so usually it involves planning ahead.
Okay.
And that's another big thing I really try to tell people or encourage them to do is plan ahead. Go ahead and bring some fruit. Bring some string cheese. Bring something that you know is good for you, so at 3 o'clock you know you have something to eat when you're hungry. Same thing for your kids. You're going on a trip. Pack a cooler. Go ahead and have some string cheese, some yogurt. Also bring a spoon because it's hard to eat the yogurt without the spoon.
This is true.
But then have some low-calorie crunchies, whether it's cereal and some nuts and some dried fruit mixed together, that thing of plan ahead.
Once again, going back to the fact that the carbohydrates aren't as bad as the fat.
Yes.
Yes.
Yes. And one other thing about planning meals that people have kind of lost this thing, we don't plan them. So if people actually think on the weekend when they're going to the grocery store, hey, on Monday night I'm going to have chicken, Tuesday I want to have chili, whatever it is, have it planned so that way you go to the grocery store, you actually have the ingredients so when you come home, you can make it. Better yet, old-fashioned technology, a crock pot.
Ah.
It's cooked when you walk in the door. It smells good too.
Yeah, definitely.
So those are some things that you can do to make life a little bit easier. And there's one other big thing that comes into all this. We're talking about food. The other side of the equation is exercise.
Ah, yes.
As Dr. Jackson mentioned earlier, we don't move much. We have just technology that ourselves out of moving. So some interesting or some easy ways, if you don't want to go out and get sweaty, take the batteries out of your remotes. You at least have to get up and walk across the living room.
Yes.
Put your cell phone and your portable phone in another part of the house. So we at least have to walk a little bit. But the biggest thing is to find an activity that you love, or at least like. My sister moved to Florida for me. She doesn't like to sweat. So I thought we need to find something inside.
Definitely.
But it can be walking, it can be running, canoeing, it can be doing your yard work, but something that you want to do and just move. So you have to burn your calories.
And that's the great thing about living in Central Florida is the fact that you can't use the excuse of, well, it's snowing outside. There's something you can always find to do.
Right. So, and we have lovely trails and stuff around here to go out and do stuff. And now with the time change, you can actually go out and walk in the evening when you get home.
This is very true.
So,
Now, what are some of the things going on in our community regarding healthy lifestyles and healthy living?
There's currently a very active project called Building a Healthier Polk. And this is a project that's coming under Polk Vision. And a group of individuals from government, schools, business have come together to create an overall plan of reducing Polk's obesity rate over the courses of the next 3 years. This is a very large group, and there are actually 7 strategy areas that are being worked on with measurable objectives. And these strategy areas look at the built environment, is looking at elementary and middle school and high school age students, upper level education with several colleges being in this work group. We're looking at healthcare providers and, gosh, okay. I know you can edit this.
Are the counties involved also?
Yes.
So local governments are.
Oh, and worksite with businesses that have employee wellness programs. So there are a lot of things going on with exercising in parks, and there are messages coming out again to encourage people to be active. So keep your eyes open and see what's coming from this project, which I think is very rewarding.
I know that it was really amazing when I was recently looking over news that the Lakeland Winter Haven area was found to be one of the least healthiest areas in all of the country. So I think groups coming together to try and figure out solutions to this problem are fantastic. So definitely
that was the
excited
Gallup
about that.
report. That was very eye-opening. A Gallup report that came out in March of 2012 said that the Lakeland Winter Haven metropolitan area was the 7th most obese in the nation.
That's amazing.
Yeah, very eye-opening.
Now I know that there are also things being done to kind of help educate the community about the outcomes from being obese, such as diabetes. Are either of you involved with that?
at Lake Wells Hospital, we actually have a free diabetes class once a month. Anyone is welcome to come. They just need to call us and let us know that they want to come, so we'll have plenty of information for them. Also, we have an outpatient diabetes education program that if their insurance is willing to pay, then we are certainly, or we'll do it for a fee as well, but we also have one-on-one counseling that way as well. Other hospitals also have this service.
I know the one at Lake Wells, from what you were just saying. You said, did I actually hear you correct and you said it was free?
Free.
That is amazing.
That's a lovely word, isn't it?
It is a lovely, lovely word.
But yes, we do it once a month. It's the fourth Wednesday of each month from 1 until 3.
Okay. And how do people get in touch with that to sign up and make sure that they can be a part of that?
Well, do I go ahead and give you the number now, or?
Sure.
Okay, the number is 676-1433, and you can just call me at extension 4177 to sign up.
Fantastic. Well, ladies, this has been very exciting, and thank you so much for coming out and educating us all about the importance of good health and avoiding becoming obese.
Thank
Thank
you.
you.
Thanks.
For more information about the Lake Wales Medical Center's Diabetes Survival Skills Education Program, call 863-678-2288. And once again, that program is completely free to Polk County residents. And if you'd like to find out more information about obesity, go to the CDC website at www.cdc.gov.